under the umbrella of supportive care that you just heard Dr. Radhashekhar speak. So thank you so much. She pretty much said a lot of the things I needed to say. um, just to give you a little bit of my background, I'm actually not from Florida. I'm from Southern California, where integrative medicine is it's part of the culture in Southern California. And anybody here know what integrative medicine is or use integrative medicine at all? Wow. Oh, one person. So integrative medicine can also be known as alternative medicine. I don't like that term because it's not an alternative to conventional medicine. Sometimes it can be called complementary medicine, but some of the medicine and integrative medicine modalities used in integrative medicine can be a standalone medicine. I like the term integrative medicine because we work well together, is not an alternative. We integrate better with conventional care to help better support you. So just to give you a little bit of my background, being from Southern California, growing up in SoCal, I got my master's and my doctorate in San Diego in Chinese medicine, and I have another master's in functional medicine and nutrition. And I'm now doing another fellowship in integrative medicine and health. So I'm going to talk to you about what integrative medicine is, and Chinese medicine, specifically more of acupuncture, massage, yoga, and meditation, and how it can be part of your journey in cancer care before, during, and after. So what is integrative medicine? Integrative medicine is a healing-oriented medicine that takes account the whole person, including all aspects of lifestyle, and it emphasizes the therapeutic relationship between the practitioner and the patient. And it is informed by evidence and makes use of all appropriate therapies. So we're very patient-centered. We believe in mind, body, and spirit, the connection between all three. So we need to get to know you and what you need and what you want to address, and we find what is the best option for you. Like I said, we focus on the mind, body, and I like to include community in there. Mind, body, and spirit and community, because it's not just you going through this, but also your family and your community. And so mind, body, and spirit is not a concept that is new. It's actually been around the time of Aristotle. Principles of integrative medicine. Patient and practitioners are partners in the healing process. Dr. Radhashekhar mentioned this earlier, that your oncologist, your radiation oncologist, the other doctors that you see are trying to cure you. They're in the treatment. I'm here in the integrative medicine department to help you, heal you, and help you thrive through your treatment and afterwards. Appropriate use of both conventional and alternative methods facilitates the body's innate healing process. Effective interventions that are natural, less invasive, and can be used whenever possible. Integrative medicine neither rejects conventional medicine nor accepts alternative therapies uncritically. Now, I will say I have a lot of patients that come and see me hoping they would hear that I would tell them not to follow a treatment strategy. And that's not, you're not gonna get that from me. So like I said, we work well together. The concept of treatment, the broader concepts of health promotion, and the prevention of illness are paramount. Now, personally, when I see a patient, these are my tenets of wellness that I usually always try to touch upon with my visits with my patients. Some of these are not conventional, and you'll probably see why. But this is just through my over a decade of working with patients that I find very important. Hydration, Janine talked about the importance of hydration and movement. Nourishment is more than just the food that you eat. It's about how you feel and what you're eating, like how it makes you feel. The mindfulness about eating. Expressing your emotions. Oh my goodness. This is so important. I encourage my patients all the time to express their emotions. Dr. Radhashekhar talked about that too, touched on psychosocial health. I put boundaries in the middle because I find that so important for patients to start working on their boundaries with themselves, the boundaries with their family and friends, and their community. Because oftentimes I find that patients have poor boundaries with themselves or even with their family or friends where they feel pressure to do certain things that they're not comfortable doing. And so I help them talk through that and work on healthier boundaries. And especially those that are going through cancer treatment and going to work. A lot of people have poor work boundaries. Getting adequate rest and sleep. Community social health. This is not often talked a lot about, but social health is an important component of health and wellness. It actually makes a bigger impact on your overall health and longevity more than eating well or even exercising. Your connection with your family, your friends, your community actually have a bigger impact on that. Self-care. Now, self-care growing up, for me, self-care was more of a luxury. As I started working with patients more and more, I realized self-care is actually a necessity, okay? Whether it be getting your nails done, getting your hair done, getting a massage, going out for a walk, reading a book, spending time for yourself, being selfish and spending that quiet time for yourself is not a luxury anymore. It's a necessity for your health and to reduce stress. And when you reduce stress, you reduce inflammation. And for digestion is very important because our gut health and the way we digest and assimilate the foods that we're eating, helps give us energy, helps fight fatigue, and also the bulk of our immune system is actually in our gut. Now I'm biased, so I'm going to spend a little bit of time speaking about Chinese medicine. That's my background. Most of my training is in. So Chinese medicine has been around for over 3,000 years, and it's a mind, body, spirit medicine. And the one thing I love about Chinese medicine is that we never separated the idea, the concept of the mind and the body. It's always been included since the beginning of Chinese medicine. I would say it's a sort of a kind of newer concept in conventional medicine in the last 30, 40 years or so. But Chinese medicine, when you are emotional, have something emotional happening, we believe that it can manifest in your body. When you're stressed out, your neck, shoulder muscles can tighten, or your lower back muscle can tighten. The brain-gut connection is not a new concept to us. We call that liver-spleen disharmony in Chinese medicine. Now, Chinese medicine is, everybody always think about acupuncture. That's just one technique that we use in Chinese medicine to work with patients. We have Chinese herbal medicine. We have exercises like Qigong and Tai Chi. Tui Na is a type of specific massage that we use in Chinese medicine. We focus a lot on diet. We focus a lot on mental health, lifestyle, but other modalities that are used that sometimes you might see like physical therapists use, it actually has roots in Chinese medicine, like myofascial decompression. That's actually called cupping. It's been around for many thousands of years. The Graston method is a scraping method that's actually called gua sha in Chinese medicine. There's a lot of benefits for cancer patients. I've been treating cancer patients for a long time, and I see cancer patients for all sorts of things. Now, these are specific benefits for cancer patients. However, cancer patients have aches, ails, and pains before they become a cancer patient. I help treat and alleviate those issues so you can feel better as you go through your cancer journey. We're known for treating a lot of pain, and it's a great option to kind of help mitigate how much pain medication that you need. Again, a lot of patients come to see me hoping and wanting to avoid using opioids. However, they're going to hear it from me. I will say, if their pain is get to a certain point, when you need the medication, take the medication, just like Dr. Radashekhar said. It relieves stress, anxiety, and may help with depression and insomnia. Helps with nausea-related, chemo-induced nausea and vomiting. Dry mouth from radiation, chemo-induced peripheral neuropathy. I see this quite a bit. Alleviates hot flashes, and it just helps support your immune system. Now, Chinese medicine is an ancient medicine, and we've never changed the language that we use to modern day. Okay, some of you guys might hear of meridians or in channels. I personally see it as a lymphatic system and the nervous system. There's a saying in Chinese medicine though, when there is free flow, there is no pain. When there's free flow, there is no pain. When there's no free flow, there is pain. Meaning, if things are circulating well and effectively, you shouldn't be experiencing pain or you feel healthier. And so the needles or the modalities that I would be using just to increase circulation, therefore make you feel a little bit more balanced and be free of pain or ailments. Now, imagine yourself when you get stressed out, you have a crick in your neck or your shoulder. By massaging it or treating it with a needle, you release that tension, things flow better, you feel better, you're not as cranky. Let me tell you what acupuncture is not. It's not based on religion, because these are common questions I always get. It's not an energy medicine, magic, or voodoo. It's not an alternative to conventional cancer treatment and therapies. And we do not target tumors or prevent cancerous cells from spreading. However, it provides significant benefits in cancer care. And it's definitely not this. So it's definitely glorified in movies. We do not cover you in needles like this. That would definitely give you pneumothorax, puncturing your lungs. Even though my other half is sitting here, and when I was starting out in school and I was playing around with the needles, somebody may have looked like this at the beginning. You know, I was a baby acupuncturist at that time. What is acupuncture? It involves the insertion of a very thin sterilized needle into specific points of the body to promote healing. Now, it's thin enough that some of my needles are as thin as your hair, but depending on the muscle and the area of your body, I might go a little bit longer. And sometimes I like to tease my patients and just show them their super long ones, but those only go to more meatier areas, more robust areas of the body. And another common question that patients ask me, do I dip my needles in anything like medicine before I put it in you? I don't know where that ever got started. No, we don't, because then it's not sterilized if we put it in something else before we put it in you. It is safe, painless, and has extremely low risk of complications. Sometimes you might get a little bruise or a dot of blood, sometimes by cleaning that up. How does it work in Chinese medicine? Really, we don't really know how it works, but there are studies to show that are suggestive of how it might work. It affects the hemodynamics of the body, such as blood pressure, heart rate, and blood flow. So basically, it increases vasodilation, increased blood flow in your body. Like I mentioned earlier, when things are flowing well, you feel better. Your body is full of nerves. You put in a needle somewhere, you're going to stimulate the nervous system, and it's going to send a signal up to our brain and cause different things to happen. Specifically, like it can help you release endorphins that can help you with pain and modulate your mood. And it reduces inflammation. And specifically, I want to mention adenosine release because a lot of the chemotherapies can cause chemo-induced peripheral neuropathy. It's suggested that adenosine gets released, increases blood circulation, and brings nutrients to the distal areas. And I treat this quite a bit with electrical stim, which I'll mention later. There are various different styles. A lot of people are trained in different styles, and usually their country of origin. I'm trained in Chinese, but my mentor outside of school is Japanese, and I also know how to do Japanese. They're just different needling style. Chinese tend to be more aggressive, Koreans needles more in the hands, and Japanese is much more gentle. There are other terms out there like trigger point, muscle motor point, and dry needling. That is also acupuncture. We don't inject anything in you while we're needling, so that's dry needling. I don't always use acupuncture points. I will tell you, majority of the time, 90% of my acupuncture treatments, I'm actually focusing on specific areas, and I will add some other points on the meridians to treat certain things. Electrical acupuncture, basically, I hook it up to a unit kind of very similar to a TENS unit to the needles, and it sends electrical impulses between the needles to get your muscles to jump a little bit or stimulate blood flow, especially in the distal areas if you have chemo-induced peripheral neuropathy. So specifically acupuncture, there's not a lot of studies specifically on gastric cancer, but we're able to find some more recent ones. In 2022, basically this is a small cohort. It shows that it can help toxicity and symptom burden in gastric cancer patients and improve quality of life. In another study in 2017, it reduces the frequency of nausea, vomiting, abdominal pain, diarrhea, and reduces the average days and cost of hospitalization and increased quality of life. scores in patients with gastric cancer. Massage. I'm pretty sure who haven't has much gotten a massage. It's one of my favorite things to do. It's one of my favorite times of week whenever I can get a massage in. Massage is, like I said, is a lot of people might see as self-care, it's a luxury. However, it's a necessity. A lot of my patients might not feel comfortable getting acupuncture, but they're more comfortable getting massage. And touch, again, is very healing. So massage is a great option for patients. It improves quality of life, reduce anxiety, reduce stress, fatigue. They can help with post-surgical scarring afterwards and swelling, and it helps move the lymphatic system. We provide massage here, inpatient and outpatient. You would have to have your physician or your APP put in an order for it. Inpatient, it is free of cost. Make sure you talk to your doctor and see if that's appropriate for you. You might not know, it's free. And if you want to get massage from all of our massage therapists are oncology massage trained, and I will speak about the importance of making sure you get massage from the right person. It is a fee for cost outside. Now, I know many of my patients might be loyal to somebody that they might be getting massage from prior to their cancer journey. However, I encourage patients to get massage for somebody that's specifically trained in oncology massage. There are a lot of issues that might arise. They need to know when they're able to massage you, where you are in your treatment to massage you. And if your platelet counts are too low, they shouldn't be massaging you. And community massage therapists might not know all that information, and they might use too much pressure and cause bruising. Or if you have metastases anywhere, it can cause fractures. So here's a website, s4om.org. It's a great site for you to find somebody in your area to help you if you're not seeing them here at Moffitt. Yoga, very popular. I'm from Southern California. In the town I'm in San Diego, literally every block has a yoga studio. I am not joking. There's more yoga studios than Starbucks and nail salons combined, and that's in Southern California. So that tells you a little bit where I'm from. It improves physical function, lower fatigue, reduce stress, and improves sleep. And it's very popular, and that's one of my patients in a Moffitt model. There's a study that just got published out this year in Supportive Care in Cancer that 16 weeks of therapeutic yoga can reduce inflammation, specifically like pro-tumorigenic cytokines. We have yoga here, both inpatient and outpatient. Definitely ask your APP or your physician to put in an order for you. And we have outpatient, we have it online virtually. You can actually ask, but it's limited due to space. You can have a personalized and personal yoga session with Sharon or Libby. And now we also have it in Spanish on Thursdays between 11 to 12. Meditation, and I will admit I am horrible at this. For some cancer patients, when used along with standard medical treatment, meditation can help lessen stress, anxiety, and depression, improve immune function, reduce fatigue, increase energy, and improve sleep, and might reduce pain. We provide this service here also at Moffitt, and it is free of cost. You can do it inpatient or outpatient. Your physician or APP can also put in an order. Basically, what meditation is, there's various ways that they'll figure out what works for you, whether it can be just focusing on your breath, focusing on a guided meditation, and it's totally free and it's really relaxing. Personally, I cannot meditate by myself, so guided meditations or group setting is more helpful for me. Let me see here. And these are my team. Got Elaine, Johnny, and Megan. Those are awesome massage therapists. Sharon and Libby is our yoga therapist, and Sharon does a lot of our mindful meditations. Any questions? Yes. You can just reach out to them and email them, and somebody from the department will call and talk to you. Yes, so you can go on the Moffitt website, or you can do moffitt.org/massage or /meditation/yoga or acupuncture, and you can get the information. And there's a phone number that you can just call and they can talk to you. The question is if you just wanted to get a consult and you don't want to have an order. Yes. So the question is, if acupuncture can help with high blood pressure.
Now,
Yes.
And do you have any data to show what percentage of patients have seen an improvement in blood pressure?
I don't have it right at the top of my head, but there are systematic reviews and meta-analysis that shows that it can help improve high blood pressure. And I will tell you, when you're relaxing and de-stressing, it naturally
Sure.
lowers your blood pressure.
And one final question. Do you find that most insurances will pay for this type of care?
So that's a great question.